Now we are to our third topic for this session, talking about AI solution and digital health. How do they influence equity issues? By Dr. Sarah WAMALA Anderson. She is a professor of health and welfare technology at MALARDALENS University, Sweden. Sarah is the former Director General of Swedish National Institute of Public Health and has previously served as Professor of Health Policy and Management, Karolinska Institute. Let's welcome Dr. Sarah WAMALA Anderson.
Hello, Sarah. Sarah, I think you're muted.
Oh, thank you. That's the classical one. Thank you so much. I am so pleased to be here, and I would like to have this opportunity that we connect with ourselves. So if we just take a few seconds just to close our eyes and just feel that we are in this digital space together. Okay, please, let's go ahead and you breathe from the stomach, of course. Thank you. Thank you very much. Now we are here. We have closed everything else that is going on. I would like to thank you very much. I really feel so pleased when you reached out, my friend, Dr. Roy Mazo, and working together with your awesome colleague, Dr. Edson. What you have done is incredible. Thank you very much for bringing us all together to have this conference. I listened to a few speakers before, and it was really high quality. I learned so much. Thank you very much for bridging the gap, because what we are going to see in the world now is the knowledge gap between different parts of the world. Last week, I was in South Africa at the University of Johannesburg, and we're talking about how do we create student mobility and staff mobility to reduce the knowledge gap between continents. So what you are doing, Dr. Loy and Dr. Edson, is exactly that. How do we use whatever we have from where we are to reduce the gap? Because if we don't do that, we'll be facing a lot of challenges. Now we are talking about digitalization, digital health technologies, artificial intelligence. But below that, we need a lot of knowledge at different levels, at the scientific level, at decision makers level, at citizen level, at professional level. So we need to link all those levels to make sure that we are talking about the same thing. And we also know that how can we get the best out of the technologies now that are booming. So thank you very much for doing that. I have learned from my previous presentations that what if you tried to have a presentation without PowerPoint? So I said, I'm gonna give this a shot today and let's see how this will move. And what I like about it actually, when you don't have a PowerPoint, so if you have any question at all, I feel like it becomes like a conversation. So when you feel that there is something you want to talk about, so let's have a conversation. And that's what I'm looking for. I believe that everybody who is in this digital space here, they have a lot of knowledge, a lot of perspectives on different things. I'm always keen to learn from others because like today, I learned so much and I feel so grateful. And I hope we continue to do that. So I was asked to talk about artificial intelligence solutions and how we are doing in Sweden. I would say that there is so much going on, and I would like us to, first of all, to think about that we are living in a wonderful time in the history of the world. So we have to remember that because there is so much going on. I would like to highlight a few mechanisms that are going on in the world. Digitalization, new type of globalization, internationalization, and the new geopolitical tensions that are going on. So we should try to understand that space that is going on around us, and then try to see how do we get the best value of artificial intelligence and digital health technologies, and all technologies that can actually enhance humanity and socio-economic development, because that's where I want to go. And I like that Dr. Roy is very keen on talking about the Sustainable Development Goals. And I think that's really very, very important, because if we don't think about that, it will be very difficult to make an impact. I would like to highlight the fact that I think every region, every country now, the new competition, the new goal, as some of my colleagues say, is going to be about data. And that's why the artificial intelligence now comes in much more. And of course, we need to understand the algorithms. Without data, there is no AI. So I think we need to go back to the data and where that data is being generated and what kind of data are we looking at and what is it going to do once we get them into those algorithms. So I'd like to discuss a little bit on that. But going back on what is happening in the world, we know that I looked at the new prognosis. It was interesting to see that by the year 2050, 40% of the global population will be 75 years and above. And also we have a lot of prognostic data showing that there is a possibility that humans will live 120 to 150 years. And I would like to bring in those perspectives to try to understand, okay, what do we want to do with AI given that trend? But on the other hand, and remember the 14% I talked about 75 years plus, if we compare to the 1950, it was only 1%. So that gives a feeling of how the population dynamics is going to look like, right? At the same time, when you look at the young people, 0 to 19 years, so we see a downgoing trend that we are going to have a lower proportion of young people. So what gap are we talking about now? And when you look at different regions, like I was on the African region last week, so you find that 70% of the population, they are 30 years, 30 and below years old. And now when we look at Europe, my colleague from Norway was talking about the growing, increasing elderly population, which is similar to all Nordic countries, many European countries, Japan, China is facing that. So what does that say? So I would like to bring in those perspectives. And in addition to that, we see that there is a trend of growing care costs. For instance, in Sweden, we put 10% of our GDP on healthcare, but only 3% on prevention. Yet we know, as previous speakers talked about, that we have an increasing prevalence of chronic diseases that could be prevented. And I know many of you who are from the public health background, then we are thinking about why are we not investing in health promotion, in prevention? Yet we have the technologies that can do that for us. I think it's going to be a very interesting dynamic now when we talk about technologies and we are talking about healthcare costs and we are talking about the deficits in health workers and having a large proportion of older people. And by the way, that we see the increasing life expectancy. But the problem is we find that many of the older people actually live 10 to 30 years with ill health that could be prevented. So which means that translates into healthcare costs, society costs, and also suffering of the people involved in that. We just had a new report. We have something called the Swedish Internet Foundation. So they wanted to see what people think about AI and what types of AI is being used a lot in Sweden. It was interesting that 25% of the Swedish people now, they at least use ChatGPT. It's very interesting. Now I'm thinking about my friend, my colleague who talked before, Dr. Chu, talking about the digital health literacy. And I really loved the way Dr. Chu, you described it very well. I'm looking forward to discussing more, because you said something that if it doesn't matter how good the technologies we have, but if people don't understand them, how to use them, then we won't move anything forward. And also, of course, the digital health literacy, as you talked about, is not only that the citizens, the patients, the individuals using them, but we also have them in different levels in society, the health professionals, the decision makers. We have a big issue there. Politicians, they need to know more about, if we talk about AI, what are we talking about? This report also showed that 30% of the Swedes think that AI is going to have a negative influence in the future. So what does that say? So there is lack of trust around the AI. And it was also mixed, because 36% also said that the AI could have a positive influence in the future. So we have a divide, that some people think that AI is very good, others think it's not really good. And then we have in between, think about the normal curve to these sides, and then in between, those who think that we don't know, could be positive, could be negative. So what does that mean in terms of our research agenda? That we need to provide more evidence to show the effects of AI from different perspectives, but also to show the potential risks and how could those be actually revised, because it's really possible to do that. It's not, I usually refer to the pharmaceutical industry, where I had the opportunity to work there. So if you have a pill and then you have done these clinical trials, beautiful ones, and then you show that this pill is not more beneficial compared to the placebo, then you have to go back to square one. But with technology, you can still change certain things. And when we talk about AI, then you have to go back to the data and then change those data, rewrite the algorithms and make things right. So we have a beautiful trend there, which can be done less costly and actually very time effective. But when we talk about AI, so we usually think that, I don't know, because I talk to young people and they are very keen about AI. And I want you to think about AI. What do you think about? What is AI actually? Because usually we want to think about things like objects. Of course, when you talk about AI-driven robotics, it's easier to understand. But when we talk about algorithms, what is in there? And I think that is what is fascinating. And what is interesting is that FDA actually made sure that they are starting to have a website on the FDA to show the upcoming algorithms being used in healthcare. What they want to do is that to make it very transparent, that you know which type of data is included in that kind of an algorithm. It's very interesting, because I think that's where we need to go. We need to have the openness around the AI to understand what is there, because even the health professionals, if you go into the surgery room, because we have a lot of AI solutions embedded in those technologies. So most of the physicians don't know what is exactly going on there. And I think we need to have that openness around that to expose what is going on within these different kinds of AI algorithms. But it's important to understand that there are, at least for today, there are about 4 main types of AI algorithms. There is a supervised learning, where you can go back and change things. There is unsupervised learning, and I think that's where we need to be careful, because you don't know what will come out later when you have the algorithm using a certain data, and it's going to start to make its own things based on that data, which could be biased and which could be less representative. And then we have the both supervised and unsupervised data machine learning, which could be actually really interesting to see if you do those two mixed models. And then, of course, there is a reinforcement learning that you have to put in the human factor using the data which is there. I think we need to understand those things. What is happening now, all countries, because this is also becoming the new gold with AI and data, and which algorithms are being used in different segments in society, not only healthcare, it's in finance, it's in logistics, it's in different things. So we need to be aware of that. And Sweden, of course, wants to be the best when it comes to the AI development and innovations. China has just launched their own strategy on AI. US is doing that. UK, many other countries are doing that. And I think which is an incredible time we are living in. But from the research side, of course, we need to follow this very closely to understand the effects and also the barriers and risks and biases that could be related to that, because it can be corrected. So when we go back to the devices, and the Norwegian colleague talked about the telemedicine, the home monitoring. So we have a lot of medical devices being used in monitoring, in diagnostics, in connections with our healthcare professionals, triage, leading to treatments, and some of them are AI driven. Okay, and then we need to understand within those medical devices. So you have sensors, and some, I believe, many of you have these beautiful smart watches. It's collecting a lot of data on different things, on your oxygen level, on your temperature, on blood pressure, on heart rate variability, all those things. But the technology behind that, behind the sensors, is being developed a lot. And many of them are AI driven, of course. But there is a technology which is called PPG, it's called the photo thermography technology, which is behind many sensors, which means that these are non-invasive, because you wonder how can a smartwatch measure my blood pressure? Because, you know, the traditional ways of measuring blood pressure are different. So this is non-invasive. What it does, because the sensor has this PPG technology, which makes photos actually within between your skin, and then get different kinds of data going on. Then you get your blood pressure showing up on your smartphone, right? But that technology is being actually, there are a lot of publications coming up now showing that we need to understand the sensitivity of the data and the accuracy of the data, because it has shown that it could be sensitive to temperatures, could be sensitive to noises, could be, and there is another one which is related actually through the digital divide and the inequalities that could come up, that depending on the tone of the skin color, you may get different measurements, because when the device starts to get the photos from your skin color, from your skin, depending on the color of your skin, it may make inaccurate measurements. So we need to be careful about which data is being used. And that's the data that will be put into different kinds of algorithms. And as you know that many of the big tech companies like Apple, Google, Amazon, they are using that kind of data to create, and they have algorithms creating this, beautiful curves afterwards, which come out with heart rate variability when you go to your doctor. Then it could be combined with another kinds of algorithms. So I just wanted to deep dive a little bit into what kinds of algorithms are we talking about, and how do they come up? And of course, it's about programming, but also, of course, the data coming in and which kinds of data is being used. And we need to think about, I remember my friend, Dr. Roy, is fascinated about our Swedish data registries. It's beautiful. We have a lot of data here. So we need to look into that data if we are going to use AI to use the registries. So we need also to understand how representative they are. Are they representing all groups in society, the elderly, the minorities, people with low education, all those things? So we need to think about that. And of course, the registries we have in Sweden, so we have a personal identifier number, which is helps it to connect. If you go to the doctor, then it will be connected. Now we have other digital platforms like the 1177, where everything is being put in there. So in terms of getting data using AI, I think there is good actually infrastructure to be able to do that. So the next thing would be to really demonstrate evidence-based, which we call real-world evidence, to show the effects and also the risks and barriers and challenges that need to be revised. I'm gonna make some few just to conclude here. I would like to. I talked about the evidence, but I want to talk about the implementation part. So this is where we find it interesting for us who are doing research in this area, because before you used to think about, and of course, health systems look different around the world. In the Nordic countries, you find that healthcare is being financed by taxation revenues. So which means we have a mixed model of the public sector deliveries and the private sector, all right? So we have that. But so which means that if we are going to buy new technologies being used in healthcare, so we must have, especially for those who are public providers, they need to have the public procurement process. So what we have seen that before implementing the technologies, including AI algorithms, so the procurement process needs to be addressed, because if we don't know which health outcomes we want to target with those new digital health technologies and how we are going to deal with variations in different groups, different categories, then the implementation won't be successful. Because if we don't have those categories already addressed in the procurement process, so we are going to get a technology that won't be able to address what we thought we wanted to do, but we had the intentions, but they were not well elaborated. So procurement is very important. And of course, we come into the equity and ethics. It's really very important. Many people are talking about responsible AI. And within the EU, we have the regulations. We have the EU AI regulation. We have the medical device regulation, which is called MDR. And there they say that, and many of the MDRs, the medical devices, they do have AI-driven solutions. So they need to show the evidence before those technologies come to market and after they've come into the market, because they want to understand the real world evidence, what happening in the real world. So we are monitoring very closely the WHO recommendations on ethical AI. I think it's really very important because it touches on the social determinants of health. That's where the equity issues come into play. And then I would like also to talk about the digital health capabilities, like Dr. Chu talked about very well. Digital health literacy is a big issue. Actually, it has been shown now to be a super determinant of health. So with that, we see that we are going to face new forms of inequalities related to AI, related to digitalization, related to all digital health technologies that need to be addressed in national and international policies. So from the research part, we need to provide the evidence that will inform new policies to address the new forms of inequalities being created by digitalization, AI, digital health technologies, where digital health literacy becomes an issue. So I'd like to thank you very much, and I think this is a global movement which you are creating, Dr. Roy and Dr. Edson, and everyone who is here. Thank you very much for this space.